What's up, guys? It's Jim, Dr. Cellini. On today's episode, I wanted to film another reaction video. I was scrolling through the trending videos on YouTube looking for videos that I could provide value for and give veterinary commentary on. But I came across a video from a content creator named Hailie Deegan, who is not just a content creator. Come to find out, she looks like she's a NASCAR driver, which is pretty crazy and awesome. But the title of this video was "The Worst Day of My Life, Please Pray for My Baby." So I thought I would maybe click on the video because it kind of had a feeling to me like they might be talking about their pet. And lo and behold, it turns out they are. So the reason I chose this video is because it is such a perfect example of what so many pet owners go through, which is finding your dog having a seizure for the first time and not knowing what to do. They did the absolute best thing, the correct thing, which you'll see in the video as they kind of describe what happens. But I thought it would be a really good discussion point to kind of go over and talk about some of the things that they mentioned in the video so that you, the listener, and maybe pet owner yourself, if you're ever faced with this situation, you have a little bit better idea as far as what to do and what to expect. So let's get to it.
With right now, 2 days ago, yesterday actually, I walked in the house, into the apartment, and our little dog I walked in and I laid down and he fell on his side and started having a seizure. I didn't know what to do. I didn't know really, I've never seen it before, so I immediately ran to him. I picked him up, and I thought he'd stopped breathing, so I kind of opened his mouth and blew into.
So it's very common when dogs have seizures for them to have irregular breathing patterns or sometimes have the appearance of not breathing. Trying to breathe for them is typically not something that you need to do as a pet owner. I wouldn't recommend trying to give breaths or anything like that unless directed by your veterinarian for some reason. Another thing I want to bring up, they mentioned how they just didn't know what to do in the video. They found their dog having a seizure and they were just at a loss. And it's very common as a pet owner to feel like you need to do something. In general, what I tell my clients if their pet's having a seizure is that all they really need to do is to make sure that they're not in any immediate danger. Like for instance, if they have a pool in their backyard and their dog is having a seizure near the edge of the pool, you obviously want to try to bring your dog away from the edge and keep them from falling in. Or any sort of falling dangers or any sort of obvious environmental dangers you want to try to avoid. The second thing I generally recommend is giving medication if your dog is already on seizures. Your vet may have a list of medications to give at home to say if they have a seizure, give this medication X, Y, and Z. The third thing, which is really the most important thing, if your dog or cat is having a first-time seizure, the most important thing by far is to get them to a veterinarian as soon as possible for evaluation. So either have a primary vet set up already in a relationship with your pet, or at least be aware of where the nearest veterinarian is to you. But also recommend knowing where a 24/7 emergency clinic is around you as well, in case it's after hours.
No one knows what to do in those situations, you know.
So what you should not do during a seizure is to try to hold a dog's tongue for any reason. A lot of people think, I don't know where this came from, that a dog will swallow their tongue and choke on it somehow. But that's not really a thing. And you can really injure yourself if you try to reach into their mouth because their mouth is moving and making biting motions a lot of the times. And they have absolutely no idea that you're their owner, what's going on. They're totally unconscious. And so they could easily bite you. And I've seen owners have pretty bad hand injuries from trying to do that. The second thing you don't want to do that I hear a lot of people ask in my practice is splash cold water on them. That's really not a good idea. Splashing cold water on them is not going to stop the seizure. And in fact, you could make an argument that it might actually make the seizure worse because you're providing extra stimulus to the dog externally. So don't splash cold water and don't try to reach into their mouth and pull their tongue or anything like that.
At about 6:05, they rushed him back. I didn't actually get to see him before he got back into the room. After they took him back and everything, they did all his blood work. All his blood work came back great.
So this is exactly what you're supposed to do. This is what I was talking about. They got their dog to the vet as soon as possible. He had one seizure and then he was immediately triaged by a veterinarian. So they absolutely did the very best thing you can do. They got their dog to a vet ASAP. So kudos to them.
He's never had problems with seizures before or anything like that. Like
he's never shown any signs. He's always
anything. Like he's been a perfect dog.
So this is very common in dogs with idiopathic epilepsy. I'll touch on the causes of seizures in a second. But dogs who have a genetic predisposition to having seizures will just one day have a seizure, completely out of the blue. There's nothing wrong with them leading up to it. It's like, boom, a seizure happens. And presumably, I think people are like this too. Just one day you have a seizure and suddenly you're an epileptic. So this is a very common thing that I hear from owners, which is they were fine. There's nothing wrong with them. And that is true. There is nothing wrong with them unless they're having a seizure. So that's very classic of what we call idiopathic epilepsy. But I'll get to the terminology and break that down a little bit more in a second.
He's such a good little dog, and he runs around like crazy. And
so, side note, I looked up their dog. I got a little stalky. Sorry about that, guys. There's a little Pomeranian who's super cute, tiny little thing, kind of maybe about the size of my Bernie. But it's a very cute little dog.
We had an option to take him home or let him stay there for 24 hours to monitor him and everything,
So when faced with this option, I generally would just default to monitoring in hospital for 24 hours after a first-time seizure, because you don't know if they're going to have a second one or not. And if they have a second one while you're at home, then that can start to descend into what we call a cluster seizure event, where they're having multiple seizures just kind of unending.
And while we were there, the doctor said he had just had another seizure, so now he was at 3.
So once you hit 3 seizures, now you're officially having cluster seizures, which is greater than 2 within 24 hours, essentially. So this is becoming more and more of an emergency situation. And as you'll see in the video, this is where we start to really need to consider specialist intervention and things like an MRI.
So they gave medicine to sedate him enough.
this stuff's gonna wear off, and the problem is when the sedating stuff wears off, that's when he's gonna have another seizure.
What she's referring to is that the primary vet is giving him a drug that's sedating him and stopping the seizure, but it's very short acting. It's not a long maintenance type drug. So if I had to guess, again, this is me guessing based on just the fact that this drug's super common for seizures. The dog's probably getting either diazepam or midazolam, which are benzodiazepine medications that are really good at stopping seizures immediately, but the drug wears off. It has a very short half-life in dogs, and once it's out of their system, their brain is completely exposed to having seizures again. So that's why they're telling them, hey, we can give you this sedative shot, and you need to get to another hospital as soon as possible because they can do more and they can start him on more permanent drug.
They gave him the stuff, handed him to me. We ran out to the car, and he was laying on my chest in the car, and Chase is driving. On the way there, I didn't know what he was supposed to be acting like, and I knew, I didn't think he was going to be that bad.
So typically after a dog has multiple seizures and they're receiving drugs like, let's say, Valium, again, I don't know, but let's just assume it was Valium, dogs are going to be very disoriented from that. They're not going to be themselves. They're going to be kind of all over the place. They might be anxious, panting a lot. They can do all sorts of weird behaviors when they're in there, and that can be really scary. A lot of the time that is due to the effects of the seizure itself and the drugs.
And his stomach wasn't moving, and I thought he died right there, and I started panicking. I started shaking and just trying to get him to open his eyes.
Yeah, I ended up taking my phone charger and throwing it, and it hit so hard against the dash that it just sparked him, and he jumped up, and I was like, holy crap, he's okay.
God.
He's okay.
And I'm trying to keep his eyes covered.
What they're kind of describing is basically the fact that he was sedated, and when they made a loud noise and kind of reached a certain amount of startle, he kind of came back to really quick. Again, if I had to guess.
How he normally is, and I didn't want him to go into another seizure or have another seizure because we couldn't do anything about it. If that could have just been the end of it, best thing I can do is hold his eyes closed and hope it's not long.
So this is giving you a good idea of how stressful this is when you've never seen something like this before and you don't know what it is, what to expect. There's a lot of just unknown. So this is kind of what the purpose of my channel is, to try to make this sort of thing more known so that people stress out less about it and you're better prepared for it. I'm not saying they weren't prepared. They're doing everything they can and they're doing all the right things. They're doing literally everything you can in the situation. But it's so stressful to be them. I've seen this play out so many times that I always feel bad for pet owners who are going through this.
with the COVID stuff. So they said, we either need to do an MRI or we can treat him as if he has epilepsy, but we don't know exactly what it is. And the MRI would tell us.
So just a quick little terminology breakdown. The definition of epilepsy simply means recurrent seizures. We know he has epilepsy just because he's had recurrent seizures already. But really what we're trying to find out when we see dogs with seizure activity with epilepsy is this idiopathic epilepsy, or is this structural epilepsy, or is this reactive epilepsy? So the difference between the three is as follows. Idiopathic epilepsy means a dog is having seizures of unknown cause. Idiopathic means we don't know the cause. We're idiots. Sort of, kind of literally means that. So many dogs are born with that condition, meaning that they're born with a brain that's just capable of creating seizures and having epilepsy. Just like some people are epileptic people, they just walk around and every now and then they have a seizure, but they're fine in between. Reactive epilepsy is when a dog has a toxin ingestion or some sort of like kidney or liver problem, something systemic going on with them that changes their blood chemistry and that changes their brain chemistry, and they have a seizure from that. Usually you can pick that up on a blood work, and they mentioned their blood work was normal at their vet, so that's usually pretty easy to rule out right off the bat. Structural epilepsy is when there's an actual structural problem in the brain. Things like a tumor, inflammation, a stroke, a malformation of their brain, like hydrocephalus, for instance, head trauma. All these different things can irritate the brain and cause a seizure. So a lot of people kind of get the terms mixed up, so that's a good breakdown and try to remember those things. What we're trying to do is use an MRI to look at the brain and see if there's a structural lesion or if it's a normal looking brain. And if the brain is normal, then by definition we have a normal brain but a ton of seizures happening, thus we have seizures of unknown cause. Versus if we see, say, meningitis or a tumor, then we have an explanation for the seizures, and that requires a different set of treatment.
Seizure,
Yeah.
high seizure.
And I don't know if you guys are financially okay to do that, and we're anything.
I would drain my bank account and take a loan for that.
So in general, the average cost of an emergency MRI and a spinal tap, which oftentimes go together, you're looking at somewhere between the neighborhood of like $2,500 to $3,500. Every market's different, but it's somewhere in that neighborhood. This is why I always recommend pet insurance.
Anyways, they took him back and they did an MRI scan and everything came out normal, and they said he's just having a series of epilepsy. And when they were trying to do the scan, they went to shove the trach down to start the anesthesia, and they noticed his lungs were full of like a red blood foam substance.
And you gotta keep in mind, he's tiny. He's 2.9 pounds. Like, his lungs are tiny.
And so they said that that's not okay and that's not normal. And they said
Especially how much was in his lungs.
they said they've seen it before, and they said, could he have gotten a rat poison? Could it? And we're like, no, like we think
We don't have rat poison or anything toxic in here he could have gone into. Like,
I've seen this happen a couple of times in my career following seizures, and again, I'm not commenting directly on his care. Obviously, I wasn't there, and I can't comment on anything that's going on with him. But when we do see something like that, and we're concerned about fluid building up in the lungs or sort of a blood-tinged fluid, there's two things we think about. One is what we call coagulopathy, meaning some sort of bleeding disorder going on in the body. Rat poison is the most common source. The second explanation, which I've seen a few times here and there, a condition called non-cardiogenic pulmonary edema. And that basically means that the lungs fill with fluid from a problem in the brain, in this case seizures. So cardiogenic pulmonary edema means the lungs fill with fluid because of the heart. Cardiogenic means the heart's causing it, like heart failure. But non-cardiogenic is basically like a problem with the nervous system sometimes causes fluid to build up in the lungs. It's a strange pathology. There's a few possible explanations for it, but that might be what the vet is concerned about here based on what I'm hearing.
And they said his head checked out okay. And
no brain trauma or anything, which I was like, good, because that's what I was worried about at first, because the little guy runs around very fast and like loves running from wall to wall, and he will go head first into the wall.
So that's the first and most important thing. His MRI was normal. So that's a really good indicator. You can rule out things like head trauma, malformations of the brain, tumors, all that stuff. So that's a really good starting place. It doesn't rule out things like meningitis entirely, but it's a good starting place.
Lungs, they said the lungs is the main concern, like, because the seizures are causing the fluid in the lungs.
So one more seizure and he could be gone.
Okay, so that might be what they're concerned about, is that non-cardiogenic pulmonary edema. He mentioned how the vet said they think the seizures might be causing the fluid in the lungs. So that might be kind of what they're worried about, and that can be a life-threatening scenario. That's a really bad condition.
Be gone.
And so I thought like that was the end of it. Like,
They said he wasn't waking up from the anesthesia.
Yeah, this is honestly so sad when this happens. I really do feel bad for not only for them, but for the owners that I've worked with and this happens. When they're not waking up from anesthesia following something like this, it's a really, you basically go into a conversation of like taking them off the vent just right then and there, rather than, you know, for people, you talk about like being taken off the vent, it's like a long drawn out process, but with this is something to where like 24 hours ago your dog was fine and now boom, they're on the vent, and you're having to talk about taking them off the vent or potentially performing humane euthanasia to kind of ease their passing. It's very difficult, and it's so sad.
And because like his lungs were just too full. So
And he wasn't waking up. And so we immediately went in the car and rushed over there. We were about 25, 30 minutes away.
You can see how sad and upset they are just by even recalling the situation. And this is just yet another example of countless examples of how strong the human-animal bond is. It is truly, even like as I talk about this right now, like I'm literally getting upset because I'm thinking about my dog Bernie being in this situation. And that's what I try to do with all my patients. But it's so strong thinking about your dog and how much they mean to you that I can literally get choked up just thinking about it right now.
I check in and like tell them who I am and stuff and who we're here for. And the lady, the main neurologist lady, comes out and she starts off by saying he's awake and he's okay. I was just so happy because last thing I had a feeling going there that we were gonna get there and he was gonna be on the table and have a breathing tube down his throat and not be okay, and then just not.
Now's a good time to point out the fact that as of the time of me watching this, 714 people hit the dislike button. I don't know what you people are thinking. I mean, could you be more insensitive? Sorry, I had to say it.
Just not wake up.
let us go back and see him. And so we went back, and he's in an oxygen tank.
Because he can't breathe to the full capacity, they did pump the liquid out of his...
It sounds like she's recalling the details here like tremendously well. And it's also very common for dogs to be in an oxygen tank, like a supplemental oxygen chamber overnight for something like this, and many other things that cause them to have trouble breathing. But it's always kind of like a standard of care to supplement oxygen to help them breathe overnight after something like this.
We went back there, the neurologist ladies took us back, and he's in the ICU and stuff. And we got to pet him, like they have little like armholes you can go through, like we got to pet him, and he...
Also, it's really great that they're able to visit their dog in a situation like this, because up until recently with COVID restrictions, most every hospital that I know of is not letting anybody in the building no matter what. So that has obviously been super stressful for owners and for veterinarians and support staff alike. So it's really good to be able to bring owners into the back and be able to see where their dog is staying overnight and visit with them.
He loves Chase's mom, and he got so excited when he saw Chase's mom, and poor little guy, a little bald spot on the top of his head.
So she mentioned the bald spot on the top of his head. I suspect, again, I don't know, I suspect that they also did a spinal tap. In dogs, unlike people, so people get a spinal tap in their lower back, they call it an LP or a lumbar puncture. Dogs, we can do that too, but we can also go behind the head in what's called the cerebellomedullary cistern, or just cistern for short. But they've got a nice little pocket of fluid in the back of their skull right on top of their brainstem that we can access that way. And since they're under anesthesia for the MRI, we typically bring them out of the MRI and perform the spinal tap right then and there. It only takes a few minutes. It's a very, very, very low risk procedure. I've never in my career seen a problem from spinal taps. People report things like headaches and like CSF leakage and stuff like that, but we don't see that in dogs. I don't know why, but we really just do not see that very often at all. The reason they do a spinal tap is basically to rule out meningitis. She mentioned his MRI was normal, but still some dogs can have meningitis and have a normal MRI. So you really need to sample the spinal fluid by doing a spinal tap. Again, that spinal fluid is the stuff that surrounds the brain. You need to sample that fluid and look at it under a microscope in order to make sure that there's no white blood cells there that shouldn't be there.
He's not in the clear.
He's not out of the woods yet, was her exact words, but he's a lot better than she thought he was going to be doing, which, oh, guy's fighter. It's crazy. He always, like, I can't even cut his hair, like, there's a little knot in his hair without him attacking my hand. And
to be fair, that does sound like most Pomeranians that I know.
For us to, like, know if we triggered it, there was nothing. Like, we've done our research and, like he was perfectly fine 2 days.
So it's very common for owners to ask if there was something that could have triggered idiopathic epilepsy to start happening, or if something they did. And it's easy to feel bad and think that you did something, but suffice it to say, in, I would say 95, 99% of dogs, there's no known trigger. It's typically just something that's going to happen in a completely unpredictable manner, and that's part of the disease. It's totally unpredictable.
I know this is probably a wreck to watch right now.
Yeah, it probably seems very dramatic, but like I never like had a love for an animal like this. I've never loved it. He never even liked dogs until we got him. And
yeah, people who think this is over dramatic do not have an appreciation for the human-animal bond. This is totally real, and this is literally this is literally like watching a helpless family member go through something, and you're at a loss as far as what's going on or trying to help them. It's that traumatic.
When, we'll get everything together and get back on our feet, and, I ask that you guys just say a prayer for my little guy. He makes it through this, and we're all good, but thank you guys for everything, and thank you for watching.
Yeah.
We'll see you at the next one.
I don't see any updates on their social media quite yet. Obviously, I'm wishing him all the best. I hope his seizures are well controlled and he's able to be discharged from the hospital and he goes home to live his life just getting seizure medication and still has a good quality of life and is just, hopefully back to normal as soon as possible. So really feel for him, really feel for them. But I think it's a really good example of a scenario that a lot of pet owners find themselves in and don't know what to do and don't know where to go and are at a loss and start to panic. So I hope I was able to kind of walk you through a situation like this. God forbid if it ever happens to you, you hopefully maybe have a better idea as far as what to do and what may be going on. So hope you enjoyed that. Feel free to hit the like and subscribe button and leave a comment below if you like this video, and I will see you next time.